Well, first of all, thanks to all of you for being here. And thank you also to John Conyers. John and I have been partners in this endeavor from the time I came to Congress. And I'm very grateful to have the chance to work with him and with all of you on advancing H.R. 676, which really is the front lash of a powerful national movement for health care for all. I particularly want to thank Mimi Kennedy and Mike Farrell, because they don't have to be here, but what they've done is, through their civic involvement, have underscored the importance of this issue for all Americans. And I want to thank both of you for lending your name. I had a chance early this morning to talk to nurses organizations. Some of you were there. And I just want to say that we don't underestimate the magnitude of the challenge that we're undertaking here. We do understand how powerful a hold that insurance companies have on our political process. But at the same time, the magnitude of support for health care for all, for a single-payer plan, has never been so great. 74 members of Congress, even early in this Congress, are already on board. We know that over 10 states have powerful single-payer movements. We know that there is a tide of public support growing in the direction of dramatically stating health care as a civil right. And I really see this as being as potent a civil rights issue as voting rights were in the past, as gaining full rights for people of color were, as gaining rights for women. This is a civil rights issue. And what we need to do is to take that spirit of the suffragettes, the spirit of Dr. King, the spirit of Gandhi, and the spirit of Cesar Chavez, and build it into this movement so that we continue to energize this already very spirited approach, which we see demonstrated here. The people are with us. This system is cracking in many ways. We see the cracks on Wall Street. We see the cracks in the military-industrial complex. The system is not sustainable. And so we have a right to ask, will the system function in the interests of the people at last? And we have a right to insist that health care be a basic right in a democratic society. This is a civil rights movement. And as with the civil rights movement, there will be counterparts in direct action that will be required for people to put themselves on the line. And we should not be afraid of that. We need to be ready to challenge this system directly in the tradition of nonviolent civil disobedience. We need to be ready to challenge this system because it is not functioning for the people. It is functioning in the interests of a few insurance companies. And so when we draw on our courage, the courage which we are all heirs and heiresses of, the courage that brought this country to foundation, the courage that sustained this country in freedom, when we draw on that courage, we will find that we have what it takes to be able to take a stand. And so let's celebrate that. This is a good day to reflect on what each of us brings to this moment, but to reflect on, across the generations, we have a lot of power in this country to be able to move change forward. So thank you for being here today. And I really appreciate the chance to work with you. I wish that I could be here for the whole hour that we have this facility, but as you know, there are votes on the floor of the House, and there's a few other things that I'm involved in. Yes?